My name is Clayton Neff, and this summer I was working as a student intern at the Johnson County Public Health Department under James Acina, addressing impaired waterways in Johnson County. Um, the goal of the internship was to identify problem areas in the waterways of Johnson County, uh, figure out where these problems were coming from, what the sources of the impairments were, and then to develop a program proposal for an intervention strategy for to be completed in the future. I worked with Johnson County Public Health, which has the goal to improve the health of the community through education, service, outreach, intervention. So that's who I was working with. Um, and impaired waterways, they are any waterway that has been impacted in some way that negatively impacts its utilization, and that could be utilized by the environment or by the public. If either of those two things are impaired, then it becomes on the impaired waterway list. And this could be wastewater, E. coli, algal blooms, excess nutrients, whatever it is, all of these things can lead to impairment. This summer, the project that I worked on was focused around researching waterways and watersheds and researching impairments and what the parameters of those impairments were. And then I was supposed to, take conclusions from the data and focus on one particular waterway of my choice to develop a program proposal for an intervention. There were some challenges along the way, and these, the biggest problems that I came up or ran into were involved with the COVID-19 situation, as well as the fact that there were very little specifics in data as far as numerical data goes. And yeah, but the intervention proposal that I came up with had a structure with defining impaired waterways, explaining why intervention is needed, describing the proposal itself, providing time and financial requirements for that proposal, and giving the intended and expected outcomes of the proposal. Now, my proposal involved gaining public and private access points to Snyder Creek in order to gain new data throughout those months, and then also to provide information to private landowners about upkeeping septic systems and the dangers of wastewater pollution and what those various impacts could be. And then finally communicating with the wastewater treatment plant about any sort of faults in their process. With this picture in the bottom left of the poster, you can see in the center is a red highlighted line. That is Snyder Creek, which is the creek and waterway that I focused on. And on the sides, highlighted yellow, are the various sources of the impairment. Some challenges that I came up with or ran into were the fact that Iowa has no numerical criteria for nitrogen and phosphorus, which are two of the primary things that point to wastewater impairments. So they are more focused on utilization based rather than pollutant based when they approach impaired waterways, and that was a big issue coming up with interventions. Overall, I think that this experience has given me valuable information on how the workforce actually is in public health, and it improved my research and evaluation skills. It helped me learn how to adapt to changing situations, and I also learned that public health issues are far more complicated than they seem. There were some surprises, such as no numerical criteria for pollutants in Iowa, and it was surprising that public health advocacy was so important. My next steps would be, to take this experience and apply it to my education as I move forward, and hopefully this intervention can and will be utilized in the future. And I'd like to give some acknowledgments to James Cecina, Dan Kramer, and Ryan Stouter for being there along the way and helping this make this experience go as smoothly as possible. Thank you.